18 years ago, I started having some symptoms of extreme fatigue. I felt as if I was actually coming down with the flu. I felt a little sick. The symptoms just kept persisting and persisting, so I went to my doctor, and she ran a few tests on me, and she did an EKG, and that EKG came back irregular. So she sent me to a cardiologist, and the cardiologist did an echocardiogram and a few other tests, and I was diagnosed with cardiomyopathy. My doctor did further testing on me to find out what my injection fraction was and to put me on medication to figure out what was right for me and what would work for me. And then about a year ago, I started having additional symptoms. I was having a lot of dizziness, the extreme fatigue also, and I had 3 episodes where I had collapsed on the floor. My doctor referred me to a cardiologist, Dr. Khan, who was at Henry Ford Hospital.
So Valerie was a patient that was actually referred to me from Monroe area. Atrial fibrillation is a condition, it's actually the most common arrhythmia in the world, where the top chambers of the heart, called atria, start beating erratically. A normal heart, the top chamber beats around 60 to 90 beats per minute, whereas in atrial fibrillation, the atria start beating at over 500 beats per minute. The patient can be asymptomatic, meaning having no symptoms at all. The patient could present also with a stroke. That could be the first manifestation. Frequently, we see patients come in with shortness of breath, fatigue, tiredness.
He looked over my test and reviewed them and talked to me about having an ICD implanted.
So a defibrillator is basically a device whose main purpose is to prevent sudden cardiac death. In the past, we used to place it only in patients who actually had sudden death, meaning a patient had cardiac arrest, on the scene, but they're lucky enough that somebody was around them. They called EMS, and EMS was able to shock them out of that cardiac arrest. But later on, over the course of the last 15, 20 years, several studies came out which showed that ICDs were also beneficial for patients that had weak hearts, even though they didn't have a history of sudden death. And we found that defibrillators placed in these type of patients actually showed an improvement in their mortality, meaning that they lived longer as compared to a patient who didn't have a defibrillator, and both of them had weak hearts.
We actually both decided that that would be the right thing for me, for my health. So we went ahead and he did the surgery, and I had the ICD implanted.
Now, if you look here, this shows both the lung fields and also the heart of Valerie, which is in the middle here. If you look here towards the left side of the patient, this is what we call the defibrillator. It's inserted right over the muscle beneath the skin and has a wire that extends from the defibrillator, goes into the vein called the subclavian vein. This vein actually lies right beneath the patient's collarbone. And this lead then extends through the veins, the vessels of the heart, and goes straight into the heart and lies right here in the right bottom chamber of the heart called the right ventricle. This is actually what we call the defibrillator lead. And what it does is that it has, at the end of it, it actually has an eye, which keeps an eye on the patient's heart rhythm. In any case, if any dangerous heart rhythm happens, it sends a signal through this wiring back to the defibrillator. The defibrillator detects that, and if it senses that it's an abnormal heart rhythm, it will send a jolt of energy or a shock through the patient's heart in order to reset it and bring it back to a normal rhythm.
This ICD was equipped with Bluetooth. And actually I was quite surprised because I didn't even know that that was available, which at that point in time I found out that this was something that was very new, and I was one of Dr. Khan's first patients to have this implanted.
Right now, all patients are getting the Bluetooth-enabled defibrillators. That is the next step in technology. We want to basically put all patients' information in the palm of their hands and let them be in charge of their own health. I think as technology has advanced over the past several years, and smartphones have become so much more readily available, we're offering this application to almost every single patient.
There are many benefits to it. If you're someone who likes to travel and it's time for you to have a transmission, you don't have to have a box with you and hold the remote over your heart. You can be on the beach laying out in the sun and the transmission is taking place and you don't even know it. Other conveniences that I really enjoy is the activity tracking. Activity is a very, very important part of your lifestyle when you have an illness. Of course, we always have to go by our doctor's recommendations on what you can do and what you cannot do.
So in Valerie's case, her cardiologist lives in Monroe. He's going to be handling all of her regular medications, managing her heart failure, looking at her diet, looking at her cholesterol, where he has led it to me to handle the defibrillator portion. And through the patient portal and the application through defibrillator, we keep a very close eye on that. If there's anything that's extremely dangerous, we contact the patient directly and advise her on what to do. If it's something that can be wait, is not that urgent, we usually let the patient's cardiologist know to take care of it. So Valerie should have a very excellent quality of life. She has, although her heart function is weak, she has minimal heart failure symptoms. She's very compliant with her diet, with her medication regimen. The cardiologist that she regularly sees, she follows up with him quite regularly, and he has a very good medical regimen. So I expect that her prognosis will be very good. And I'm not even sure if she'll actually even use the defibrillator. We have many patients that we put the defibrillator in as a prophylaxis or as what we call a preventive measure, but they may not ever use it at all. So I'm hoping that will be the case with Valerie, and she'll continue her medication and her pay close attention to her diet. She also exercises. I think she'll be very good.
I would like to thank Dr. Khan for recommending me to get the ICD with the Bluetooth. It has made a lot of positive changes in my life. It has simplified my life, and I would recommend it to any patient who needs to have an ICD implanted.